Welcome, my name is Carol Zarakor. My presentation will explain the importance of learning theories in healthcare. I will also compare and contrast three theorists relating their theory to the practice of OT. Throughout the presentation, there will be links to several videos that further clarify the need for theory in healthcare. At the end of each slide, you can click on the links to view the material if you prefer. So let's get started. What if healthcare had no theories? Let's consider. Without a theoretical framework, how can we be sure that healthcare is value-based? How can we be sure that insurance covers our healthcare? When the patient goes to the doctor, how can he be sure that the physicians are competent, trustworthy, and evidence-based? So the doctor assesses the patient. How can the doctor be sure that the assessments are based on proven facts and not irrelevant? The doctor recommends treatment. How does he know that the treatment interventions are safe, evidence-based, and appropriate for the condition? Then the patient returns for follow-up. How does that patient know that he's getting quality care? And how do the physicians and the facilities know that quality is being based on evidence and is being measured according to evidence-based facts? Well, literature supports theory. According to Reeves and Heen, theory is essential for intelligent practice, that theory and practice cannot and should not be separated. Indeed, taken to its logical endpoint, one could concur with Erot's 2003 argument that practice without theory is tantamount to malpractice. According to Makanta et al., good theory contains generalized, well-formulated knowledge that is supported by sound argument and evidence from those whose competence is trusted. And the definition of value that can be applied in research should capture the total cost of care and optimal outcomes. According to Dewey, 1923, that the meaning or value of a theory lies in its practical consequences. And again, Makanta et al. Findings from such research will help inform policy changes relevant to the new environment of care, because it will be based on carefully defined concepts of value and value-based care. What if theorists were therapists? Let's consider. In the next few slides, I will demonstrate how healthcare practitioners use theory as a basis for intervention. Occupational therapy intervention through the eyes of three theorists.
In a perfect world, according to Piaget, children adapt to their environment through assimilation and accommodations using schemes. The child matures through 4 stages of cognitive development: sensory motor infancy, pre-operational toddler, concrete operational elementary and early adolescence, formal operational adolescence and adulthood. According to Erikson, psychosocial crises are required to progress through 8 stages of human development: infancy, toddler, early childhood, middle childhood, adolescence, young adulthood, middle adulthood, older adulthood. According to Kohlberg, he has 7 stages that are loosely tied to age and more so to cognitive development regarding decision-making ability. They are punishment and obedience, instrumental relativism, interpersonal concordance, law and order, social contract, universal ethical principle, and ontological religious approach.
Meet Ethan. Ethan is a 3-year-old with oral hypersensitivity.
Let's look at Ethan from Piaget's 4 stages of cognitive development. Which level would Ethan fit into without oral hypersensitivity? Yes, the preoperational toddler stage. Where would Ethan fit into with his oral hypersensitivity? Correct. The sensory motor infant stage, where knowledge is based on sensory experiences.
What if Erik Erikson met Ethan?
Let's look at Erikson's 8 stages of cognitive development and how they relate to Ethan. Which level would Ethan fit into without oral hypersensitivity? And in the toddler level, where autonomy versus shame. And what about with oral hypersensitivity? The infancy stage, trust versus mistrust. So now what happens? With Ethan being at the infancy stage, he's in crisis and is unable to progress to the next stage. So there must be some type of crisis intervention, which was the oral stimulation techniques that you saw on the previous video.
What if Kohlberg saw Ethan?
Let's look at Kohlberg's 7 stages of cognitive development. Where would he stage Ethan? Yes, in the punishment and obedience stage, where actions equal consequences. Let's take a look at the theoretical basis for intervention, comparing all 3 theorists. We'll take a look at Piaget first. Piaget might say that Ethan is not accepting oral motor experiences, thereby not being able to accommodate to the stimuli. Using the developmental model, Ethan requires experience with the environment to progress to the next stage. By presenting oral motor stimulation exercises using the Piaget theory, Ethan can progress. Now let's take a look at Erikson. Erikson might say Ethan is in a crisis in the infancy trust versus mistrust stage. From Erikson's point of view, unless he works through this stage, he will not progress further. Ethan will need to master the oral motor skills through repeated provision of sensory oral motor experiences. And then there's Kohlberg. Kohlberg might say that Ethan is having difficulty organizing his sensory system. By assisting Ethan to further understand the interaction between the food textures and his sensation, he should progress past the hypersensitivity. Kohlberg would most likely take more time with oral motor exercises so that Ethan can restore his own balance and reality. Meet Sam. He is learning to interact with friends while at school. What if Piaget met Sam? What would Sam's OT plan of care look like? What would the assessment look like? Let's take a look. According to Piaget, which level would Sam fit into according to his chronological age? Yes, concrete, elementary and early adolescence. Which level does Sam fit into given his current level of social interaction? Yes, the pre-operational toddler stage, where you see egocentric behavior.
What if Erik Erikson met Sam?
Now we have Erikson's 8 stages of development. Which stage would Sam be in chronologically? Yes, probably between adolescence and middle childhood. What about with his current social skills? Early childhood. Correct. What if Kohlberg saw Sam? Kohlberg's 7 stages of cognitive development. Where should Sam be based on age? Probably interpersonal concordance, where behavior is judged by intent. Where would Kohlberg stage Sam? Instrumental relativism. It's like Sam is saying, if Jonathan will give me time to talk, then I'll give him time to talk. Let's compare the 3 theorists on the basis for the intervention. Here we have Piaget. Piaget might say that Sam is having difficulty getting his story across to Jonathan. He is very egocentric. In order to progress to the next stage, Sam will need practice interacting with other peers in order to accommodate to new relationships. Erikson. He might say that Sam has found himself in a social crisis and is competing for time with the bigger story. He wants to tell his story and not necessarily listen to his friend. Erikson would have Sam work through this crisis, and as an OT, he would teach social skills, as was demonstrated in the video. Kohlberg. Kohlberg might say Sam is wanting to express himself without consideration of his friend, more on a parallel level. Kohlberg, as an OT, would use theoretical justice with the boys and teach them empathy and interpersonal social skills.
Meet Allison. She is a stroke survivor returning home.
According to Piaget, which level would Allison fit into prior to the stroke? Yes, formal operational, adolescence to adulthood. Which level does Allison fit into after the stroke? Yes, the same level. Piaget's levels are not as descriptive as some of the other theorists. According to Erikson's 8 stages of cognitive development, which level would Allison fit into prior to the stroke? Yes, middle adulthood, where she's teaching and mentoring others. Now, which level does Allison fit into after the stroke? Older adulthood, where she's reflecting on things that have happened and the mistakes that cannot be corrected. And probably, how is she going to function now that she's having to learn to adapt after the stroke? Do you think that she's having relationship problems too? And if so, would it be possible that she might have some problems with the young adulthood stage? According to Kohlberg's 7 stages of cognitive development, where would Allison be staged based on her maturity level? Yes, probably the universal ethical principle. And where would Kohlberg stage Allison now? Probably social contract, due to the fact that she's learning what her rights are and how she's going to respond to her disability at this point. Comparing the 3 theorists, let's see what they might say about Allison. Piaget might say that Allison has lived an exciting life and enjoyed family, friends, and outdoor activities. She would remain in the formal operational stage with her ability to relate logically to her disability through the assistance of therapeutic intervention. An occupational therapist would provide resources and support for adaptations necessary to live as independently as possible. Erikson might think that Allison, prior to her stroke, had reached the middle adulthood stage, feeling very satisfied with her contributions to society and her ability to mentor her family. Following the stroke, Allison is having relationship difficulties due to feeling dependent on others and not fitting into her previous group. She's also feeling despair due to what the future may hold. An occupational therapist would provide adaptations and restorative training for returning to independence as soon as possible. Kohlberg says Allison is struggling between being a burden and receiving what she deserves following her disability. An occupational therapist will provide restorative and adaptive intervention as well as resources to assist with obtaining assistance that she needs and deserves. Now we know that by using the theory, the occupational therapist knows where to begin and how to provide interventions. We also know that healthcare requires theory to explain how and what should be studied. Theory provides key ideas and how to think about them through knowledge development. Theory systemizes knowledge that aids in our understanding and enables knowledge to be transferable. Theory provides predictability that can be repeated and generalized to ensure probable outcomes in healthcare practice and development. A well-elucidated theory can provide more comprehensive views of rural health and remote health. And I'll leave you with this. He who loves practice without theory is like the sailor who boards ship without a rudder and compass and never knows where he may cast. Leonardo da Vinci. Thank you for listening.